Question 1. Given the circumstances, Ms. Roberts, a radiologic technologist, is performing a chest X-ray on a patient. After taking the initial image, Ms. Roberts notices that the film appears overexposed with an overall increase in density. What should she adjust in order to optimize the image quality? A. Increase the and decrease the KVP. B. Increase the KVP and decrease the MAR. C. Decrease the KVP and increase the MAR. D. Decrease both the KVP and MAR. Answer. Correct answer. B. Increase the KVP and decrease the MAR. Explanation. Overexposure leads to an excessive amount of radiation reaching the image receptor, resulting in high density. To reduce exposure while maintaining image quality, decreasing the MAR milliamperage reduces the quantity of radiation, while increasing the KVP millivolt peak can improve penetration without overexposing the film. According to radiation safety optimization principles, this approach follows the lower as low as reasonably achievable principle by reducing patient exposure. Question 2. In the context of radiation safety, how does the inverse square law relate to radiation dose exposure in radiographic procedures? A. The dose is directly proportional to the square of the distance from the source. B. The dose is inversely proportional to the square of the distance from the source. C. The dose remains constant regardless of the distance from the source. D. The dose increases with distance but at a decreasing rate. Answer. Correct answer. B. The dose is inversely proportional to the square of the distance from the source. Explanation. The inverse square law states that as the distance from the radiation source increases, the radiation dose decreases exponentially, following the formula equals 1d2d d21. This principle is vital for radiologic technologists to understand, as it directly impacts how radiation exposure is minimized, particularly in person safety and patient protection during diagnostic imaging. Question 3. Mr. Smith is scheduled for Reiki with contrast media. Upon questioning, he reveals a history of allergic reactions to shellfish. Which of the following actions should be prioritized before proceeding with the contrast injection? A. Administer an antihistamine and proceed with the procedure. B. Avoid contrast media and suggest the different imaging technique. C. Proceed with the procedure but at a lower dose of contrast media. D. Ensure that the patient's history of allergies is documented and take premedication steps as prescribed. Answer. Correct answer. D. Ensure that the patient's history of allergies is documented and take premedication steps as prescribed. Explanation. Shellfish allergies may indicate a potential for reaction to iodine-based contrast media, which can cause severe allergic reactions. Per guidelines from the American College of Radiology, ACA, and Radiological Society of North America, SNI, premedication protocols, such as corticosteroids, antihistamines, are recommended for patients with a history of allergies to shellfish before contrast administration. This procedure ensures patient safety and minimizes the risk of contrast-induced reactions. Question 4. What would happen if a radiologic technologist used a high KVP setting and a low during a fluoroscopy procedure? A. The image quality would improve, but the radiation exposure would also increase. B. The image quality would degrade and the patient exposure would decrease. C. The image quality would improve and the patient exposure would decrease. D. The image quality would degrade and the radiation exposure would increase. Answer. Correct answer. B. The image quality would degrade and the patient exposure would decrease. Explanation. High KVP increases the energy of the X-rays, allowing for better tissue penetration, while low reduces the radiation quantity. However, during fluoroscopy, using low may result in inadequate image quality because the reduced exposure results in less detail. While patient exposure may decrease, image quality could be compromised unless technologist compensates by optimizing the other factors, such as increasing the or adjusting the image processing settings. Question 5. In an emergency situation, Mr. Garcia, a radiologic technologist, is tasked with imaging a patient with a suspected fractured pelvis. What is the most important consideration when positioning the patient for the radiograph? A. Position the patient in a way that maximizes radiation exposure to achieve a better image quality. B. Maintain the patient's safety and comfort and minimize movement. C. Increase the to ensure high-quality image despite the injury. D. Focused solely on achieving clear image without considering the patient's injury. Answer. Correct answer. B. Maintain the patient's safety and comfort and minimize movement. Explanation. In trauma cases like suspected pelvic fractures, the patient's safety and comfort are of utmost importance. Moving the patient too much can worsen the injury. According to the National Radiologic Technology Board, i.e., proper immobilization and minimizing unnecessary movement should be prioritized. The radiologic technologist must carefully put the patient to avoid further harm while obtaining diagnostic images. Question 6. Under the assumption that a radiologic technologist has followed proper infection control procedures, which of the following is the best practice when handling a patient who is immunocompromised? A. Use gloves and a gown, but avoid using a mask. B. Use standard precautions only and avoid additional protective measures. C. Use appropriate personal protective equipment, PPE, such as gloves, gown, and mask to reduce the risk of infection. D. Wash hands and disinfect equipment without wearing any additional protective gear. Answer. Correct answer. C. Use appropriate personal protective equipment, PPE, such as gloves, gown, and mask to reduce the risk of infection. Explanation. Immunocompromised patients are at higher risk for infections. Radiologic technologists should adhere to standard precautions, including the use of PPE such as gloves, gowns, and masks, according to guidelines from the Centers for Disease Control and Prevention (CDC). The additional measures ensure that the patient is not exposed to infectious agents and it minimizes the spread of pathogens. Question 7. Which of the following is a primary factor influencing the effectiveness of lead shielding in radiography? A. The thickness of the lead material. B. The patient's age. C. The type of X-ray tube used. D. The time of exposure. Answer. Correct answer. A. The thickness of the lead material. Explanation. The effectiveness of lead shielding in reducing radiation exposure is directly related to the thickness of the lead material. According to the Alara principle, the thicker the lead shield, the more effective it is at absorbing and attenuating radiation. The U.S. Department of Health and Human Services recommends using lead aprons with a minimum thickness of 0.5 mm pp to provide adequate protection. Question 8. What is the primary purpose of performing quality control QC tests on radiographic equipment? A. To ensure that the equipment is operating efficiently and producing diagnostic images at the lowest possible radiation dose. B. To maintain the equipment warranty and extend its operational life. C. To comply with state regulations for equipment usage in clinical settings. D. To meet the requirements for equipment insurance claims. Answer. Correct answer. A. To ensure that the equipment is operating efficiently and producing diagnostic images at the lowest possible radiation dose. Explanation. Quality control QC tests are crucial to ensuring that radiographic equipment is functioning optimally, producing high-quality images and minimizing patient radiation exposure. The American College of Radiology (ACA) and the Radiological Society of North America (RSNI) routine UC procedures as part of a comprehensive radiation safety program to meet federal and state regulations while adhering to the Alara principle. Question 9. From the perspective of radiation protection, which of the following is an acceptable method for minimizing the radiation dose to the patient during a fluoroscopic procedure? A. Increasing the fluoroscopic frame rate to achieve a higher resolution image. B. Limiting the exposure time and using intermittent fluoroscopy. C. Maximizing the X-ray tube current to ensure adequate image brightness. D. Reducing the distance between the X-ray tube and the patient. Answer. Correct answer. B. Limiting the exposure time and using intermittent fluoroscopy. Explanation. The most effective method of minimizing patient radiation dose during fluoroscopy is to limit exposure time. The longer the exposure time, the higher the radiation dose. Intermittent fluoroscopy, which involves pulsed X-ray delivery, reduces dose compared to continuous fluoroscopy. This aligns with the Alara principle, ensuring radiation exposure is kept to a minimum while still obtaining necessary diagnostic information. Question 10. When evaluating a radiographic image, what is the primary purpose of adjusting the collimation? A. To ensure the entire area of interest is included even if it results in excess radiation. B. To limit the area exposed to radiation, reducing the amount of unnecessary tissue radiation. C. To maximize the image contrast by reducing scatter radiation. D. To increase the film density for a clearer image. Answer. Correct answer. B. To limit the area exposed to radiation, reducing the amount of unnecessary tissue radiation. Explanation. Collimation is the process of adjusting the X-ray beam to the area of interest to reduce unnecessary radiation exposure to adjacent tissues. This technique minimizes scatter radiation, improving image quality and adhering to the ALARA principle. The American Radiological Association (ARA) emphasizes the importance of collimation in optimizing patient safety during diagnostic imaging procedures. Question 11. In the context of patient radiation protection during fluoroscopic procedures, a radiologic technologist, Jane, is performing a gastrointestinal study with fluoroscopy. She notices that the patient's body habitus makes it difficult to visualize the required anatomy clearly. Jane wonders whether to adjust the technique and what method will ensure the lowest possible radiation dose to the patient. Which of the following actions should Jane take to minimize radiation exposure while achieving the necessary image quality? A. Increase the exposure time to enhance the image quality. B. Use a higher KVP setting to improve image quality and reduce patient dose. C. Reduce the fluoroscopy time by ensuring the patient is positioned optimally. D. Decrease to reduce the dose and keep the image quality acceptable. Answer. Correct answer. C. Reduce the fluoroscopy time by ensuring the patient is positioned optimally. Explanation. Reducing fluoroscopy time and optimizing patient positioning are critical steps in minimizing radiation exposure. Positioning the patient correctly ensures that the radiologist has a clear view of the area of interest, allowing for efficient imaging with minimal radiation. The ALARA principle, as low as reasonably achievable, encourages the reduction of radiation exposure by optimizing technique and minimizing unnecessary exposure, particularly in procedures like fluoroscopy. Increasing exposure time or altering KVP and may increase dose unnecessarily without improving image quality significantly. Question 12. During a routine quality control test on an X-ray machine, technician Robert notices that the alignment of the X-ray tube is slightly off-center. The deviation might cause misalignment in the radiographic images. Robert is considering whether this could lead to any potential issues in clinical practice. What is the most likely consequence of this misalignment, and what action should Robert take? A. The misalignment will likely cause distortion in the image, making it harder to assess anatomy. B. Misalignment may not affect image quality, as radiographs can still be acquired with adequate settings. C. The misalignment could lead to increased patient dose, as the beam will no longer be centered on the receptor. D. Misalignment will have no effect on the final image, as collimation will compensate for this error. Answer. Correct answer. C. The misalignment could lead to increased patient doses. The beam will no longer be centered on the receptor. Explanation. Misalignment of the X-ray tube can cause unnecessary radiation exposure to areas outside the intended region of interest, which increases patient dose. Proper alignment is critical to ensure that the X-ray beam is centered on the imaging receptor, which minimizes scatter radiation and optimizes image quality. Distortion and other image quality issues are also possible, but the primary concern in this scenario is the increase in radiation dose, which violates the ALARA principle. Question 13. Given the circumstances in a pediatric radiography procedure, technician Susan is preparing to perform an abdominal X-ray on a 3-year-old patient. The child is anxious and cannot remain still for the required exposure. Susan is considering the use of restraint devices to prevent motion blur during the procedure. What is the best approach to ensure patient safety and minimize radiation exposure? A. Use the minimum necessary restraint device to hold the patient still, even if it means increasing exposure time. B. Hold the child manually during the procedure while keeping the radiation beam directed away from the patient. C. Obtain assistance from a caregiver to hold the child still, but avoid increasing radiation exposure time. D. Apply appropriate shielding and use a higher KVP to reduce the exposure time and achieve image. Answer. Correct answer. C. Obtain assistance from a caregiver to hold the child still, but avoid increasing radiation exposure time. Explanation. The best approach in pediatric radiography is to ensure that the child is safely restrained using appropriate techniques without increasing the exposure time. Using a caregiver for assistance minimizes the need for restraining devices that could cause additional discomfort or unnecessary radiation exposure. The alloraprint emphasizes minimizing exposure, especially in pediatric patients who are more sensitive to radiation. Increasing exposure time or using unnecessary restraints would increase patient dose, which should be avoided. Question 14. In an effort to improve the diagnostic quality of a chest X-ray, radiologic technologist Mark is considering using a higher setting for the exposure. He is aware that this will increase the dose to the patient, but wonders whether the trade-off is justified for improved image clarity. What principle should Mark consider when deciding whether to increase for the chest X-ray? A. The benefit of higher is always greater than the additional radiation dose. B. Increasing can improve image quality, but it must be weighed against the lower principle. C. Higher will reduce the exposure time, leading to a lower overall dose without any compromise in image quality. D. Increasing is necessary to obtain diagnostic quality images for chest X-rays in all cases. Answer. Correct answer. B. Increasing can improve image quality, but it must be weighed against the Alara principle. Explanation. The decision to increase should be made with careful consideration of the Alara principle, which aims to minimize radiation exposure while achieving the necessary image quality. Higher can improve image quality by increasing density, but it also increases the patient's dose. In most cases, technologists should optimize other factors, such as KVP or exposure time, before resorting to a significant increase to maintain a balance between diagnostic quality and safety. Question 15. During a mobile radiography procedure in an intensive care unit, ICU technician Lisa is performing a chest X-ray on a critically ill patient. Due to the patient's condition, she is concerned about the potential for unnecessary radiation exposure. Which action should Lisa take to ensure that radiation exposure is minimized while maintaining image quality? A. Use a higher KVP to reduce the amount of radiation needed for the procedure. B. Increase to reduce exposure time and avoid patient movement. C. Employ proper collimation and limit the area of exposure to only the necessary anatomy. D. Ensure that the X-ray tube is as close as possible to the patient to improve image clarity. Answer. Correct answer. C. Employ proper collimation and limit the area of exposure to only the necessary anatomy. Explanation. In mobile radiography, it is essential to use proper collimation to limit the radiation field to only the necessary anatomy, thereby reducing unnecessary exposure to surrounding tissues. While increasing or KVP might seem like a good way to improve image quality or reduce exposure time, it could lead to unnecessary radiation. Collimation is a key method for adhering to the Alara principle, as it focuses the beam on the area of interest, minimizing dose to the patient. Question 16. According to recent studies, personnel monitoring for radiation exposure is vital in ensuring safety for healthcare workers in radiologic departments. Technician Tom is responsible for wearing a dosimeter badge while performing diagnostic radiology procedures. He is also tasked with ensuring that all radiation exposure limits are adhered to. What is the primary role of Tom's dosimeter badge in this context? A. To measure the total exposure of the patient during the radiologic procedure. B. To track Tom's exposure to radiation during each procedure, ensuring it stays within the permissible limit. C. To provide immediate feedback on image quality during procedures. D. To determine the dose received by the equipment during the diagnostic procedure. Answer. Correct answer. B. To track Tom's exposure to radiation during each procedure, ensuring it stays within the permissible limit. Explanation. The dosimeter badge is worn by radiologic technologists and other personnel to monitor their exposure to ionizing radiation. It does not measure patient exposure or equipment dose. By tracking accumulated radiation exposure, it ensures that personnel are adhering to maximum permissible dose (MPD) limit, mandated by radiation safety regulations, including federal, state, and institutional guidelines. The badge allows for timely corrective actions if exposure limits are exceeded. Question 17. In response to a new regulation on radiation safety, radiologic technologist Megan is tasked with reviewing the equipment safety procedures in the imaging department. She notices that some of the radiographic equipment lacks proper calibration for certain safety features. What should Megan do to ensure compliance with radiation safety regulations? A. Continue using the equipment as is as long as the images are still diagnostic. B. Calibrate the equipment immediately and report any non-compliance to the relevant authorities. C. Recalibrate the equipment only if a radiation safety officer detects a problem. D. Replace the equipment if it does not meet the safety standards specified by the manufacturer. Answer. Correct answer. B. Calibrate the equipment immediately and report any non-compliance to the relevant authorities. Explanation. Equipment calibration is essential to ensure that the radiographic equipment meets radiation safety standards and produces high-quality, accurate images. If Megan notices that equipment is not calibrated correctly, she should take immediate action to correct the problem. Compliance with safety regulations is crucial to prevent overexposure to patients and personnel. Reporting any non-compliance to the appropriate authorities ensures that the department maintains the highest safety standards as per federal and state regulations. Question 18. From a historical standpoint, the development of digital radiography doctor systems has significantly impacted imaging practices. Technologist Alex is preparing to switch from film screen radiography (FSR) to doctor for all future procedures. He is aware of certain key differences in the image quality and exposure requirements between the two systems. What is the most important consideration Alex must account for when transitioning to doctor? A. Doctor systems require a higher patient dose due to the increased sensitivity of the imaging receptor. B. Doctor systems have improved image quality but may require more complex post-processing steps. C. Doctor systems provide lower image quality than FSR and require more exposure to achieve diagnostic results. D. Doctor systems are more sensitive and exposure settings should be adjusted to prevent overexposure. Answer. Correct answer. D. Doctor systems are more sensitive and exposure settings should be adjusted to prevent overexposure. Explanation. Digital radiography systems are more sensitive than traditional film screen systems, which means they require careful adjustment of exposure factors to avoid overexposure, while Doctor improves image quality with better contrast and detail. Using incorrect exposure settings can result in excessive radiation dose. Technologists must adapt exposure protocols to ensure optimal image quality while minimizing dose. Proper dose management is crucial to adhere to the ALARA principle and avoid unnecessary patient exposure. Question 19. While examining the consequences of using incorrect positioning techniques, technologist Rachel notices that a patient's abdomen is not positioned correctly for a lateral projection. She is concerned about the potential impact on both image quality and patient safety. Which of the following is the most likely consequence of incorrect positioning during this procedure? A. The image will be overexposed, requiring a repeat procedure. B. The image may be distorted, making it difficult to assess the required anatomical structures. C. The image will be underexposed, resulting in a loss of contrast. D. The patient will not experience any discomfort from the incorrect positioning. Answer. Correct answer. B. The image may be distorted, making it difficult to assess the required anatomical structures. Explanation. Incorrect positioning during a radiographic procedure often leads to distortion of the image, which affects the accuracy and diagnostic value of the radiograph. Inaccurate positioning can obscure critical anatomical structures, leading to misinterpretation or the need for repeat imaging, which increases patient exposure. The ALARA principle emphasizes reducing unnecessary exposures, which includes avoiding repeated procedures caused by poor positioning. Question 20. A common misconception about radiation safety is that protective shielding can completely eliminate the risks of ionizing radiation. Radiologic technologist Lisa is preparing to perform a chest X-ray on a pregnant patient and is considering the use of lead shielding. Which of the following best describes the proper use of protective shielding in this situation? A. Shielding will completely eliminate the radiation risk to the fetus and should always be used. B. Shielding should be used only for the patient's abdomen to protect the fetus from exposure. C. Shielding should be used on the patient but is not necessary for pregnant patients. D. Shielding should be used as a supplementary measure but cannot eliminate all risks. Answer. Correct answer. D. Shielding should be used as a supplementary measure but cannot eliminate all risks. Explanation. Protective shielding such as lead aprons, significantly reduces radiation exposure but does not completely eliminate risks, especially for vulnerable populations such as pregnant patients. Shielding should be applied to areas not directly involved in the imaging, such as the patient's abdomen, to reduce radiation exposure to the fetus. However, it is important to note that shielding cannot completely negate the risk of ionizing radiation, so every effort should be made to limit exposure through careful technique and adherence to safety standards. Question 21. Radiologic technologist Anna is working with a patient who has a history of scoliosis. She needs to take a spinal X-ray but is concerned about the potential for motion during the exposure due to the patient's discomfort. What should Anna do to minimize the potential for motion artifacts while maintaining image quality? A. Increase the exposure time to allow the patient more time to hold still. B. Use a higher to decrease exposure time and reduce the risk of motion. C. Ask the patient to hold their breath during the exposure to prevent movement. D. Position the patient as comfortably as possible and take multiple exposures to ensure quality. Answer. Correct answer. B. Use a higher to decrease exposure time and reduce the risk of motion. Explanation. Increasing the allows for a shorter exposure time, which is beneficial when a patient has difficulty staying still. Shorter exposure times reduce the likelihood of motion artifacts while keeping the radiation dose to a minimum. Asking the patient to hold their breath or using multiple exposures might increase discomfort or unnecessary radiation. Question 22. In a busy hospital setting, radiologic technologist Sam is responsible for monitoring the usage of protective equipment during radiographic procedures. A new intern, Jenny, is unsure whether she should use a lead apron for a routine hand X-ray. What should Sam advise Jenny regarding the use of lead aprons in this situation? A. Lead aprons should always be used for all radiographic procedures, including hand X-rays, regardless of the area being imaged. B. Lead aprons are not necessary for hand X-rays as the exposure to radiation is minimal in this region. C. Lead aprons are only necessary for procedures involving high radiation doses such as fluoroscopy. D. Lead aprons are not required if the technologist is standing more than 6 feet from the radiation source. Answer. Correct answer. B. Lead aprons are not necessary for hand X-rays as the exposure to radiation is minimal in this region. Explanation. Hand X-rays are associated with relatively low radiation exposure compared to other procedures, so the need for lead shielding is minimal. However, for high-dose procedures, e.g. fluoroscopy, shielding is strongly recommended. It is important to balance radiation protection with the Alara principle, shielding only when necessary. Question 23. Ethnologist Brian is preparing to conduct a mammography examination for a 55-year-old woman. He is aware of the importance of optimizing imaging protocols to reduce unnecessary radiation exposure. Which of the following actions should Brian take to ensure optimal image quality and patient safety during the mammogram? A. Increase the exposure time to enhance image quality and detail. B. Decrease the kVp to reduce radiation exposure at the cost of image clarity. C. Use a lower compression force to avoid patient discomfort even if it affects image quality. D. Use the lowest possible radiation dose while adjusting the imaging technique to ensure diagnostic quality. Answer. Correct answer. D. Use the lowest possible radiation dose while adjusting the imaging technique to ensure diagnostic quality. Explanation. In mammography, it is essential to use the lowest possible radiation dose while ensuring diagnostic image quality. The use of compression helps to reduce dose while improving image quality by spreading out the breast tissue. Technologists should adjust exposure settings, e.g. kVp and masked radiation protection and the diagnostic need. Question 24. During an interventional fluoroscopy procedure, radiologic technologist Susan is concerned about the potential for radiation exposure to the surgical team. The procedure is expected to take a significant amount of time. What should Susan do to minimize radiation exposure to the surgical team? A. Ensure that the surgical team wears lead aprons and shields throughout the procedure. B. Increase the fluoroscopy time to reduce the number of exposures needed. C. Place the surgical team as close to the radiation source as possible to ensure better image quality. D. Use the highest possible exposure settings to reduce the number of exposures. Answer. Correct answer A. Ensure that the surgical team wears lead aprons and shields throughout the procedure. Explanation. The primary concern in fluoroscopy procedures is radiation exposure to the healthcare team. Ensuring the surgical team wears appropriate protective shielding, including lead aprons, thyroid collars, and lead gloves, is crucial to minimize exposure. Decreasing exposure time and optimizing imaging settings will also help reduce exposure, but not be done at the expense of image quality. Question 25. Ethnologist Emily is preparing to perform a pediatric X-ray on a 5-year-old patient with a possible fracture. She is concerned about how to balance image quality with minimizing radiation exposure. What is the best approach Emily should use to ensure both high-quality imaging and low radiation exposure? A. Increase the exposure settings to ensure a clear image, regardless of dose. B. Use the same exposure settings as for an adult patient, as pediatric patients require similar doses. C. Utilize lower exposure settings appropriate for pediatric patients and make adjustments to achieve image clarity. D. Use a higher dose and post-processing techniques to enhance the image quality afterward. Answer. Correct answer. C. Utilize lower exposure settings appropriate for pediatric patients and make adjustments to achieve image clarity. Explanation. Pediatric patients are more sensitive to radiation than adults, so it is essential to reduce exposure settings while still achieving diagnostic image quality. Technologists should adjust KVP, mass, and other settings based on the patient's size and the clinical indication. Post-processing technique. They used sparingly to enhance images rather than relying on high exposure settings. Question 26. Radiologic technologist John is preparing to perform a scan on a patient with a suspected stroke. He is aware that certain factors may affect the radiation dose. What should John do to minimize the radiation dose during the CT procedure? A. Use a higher slice thickness to reduce the number of slices acquired, thus reducing dose. B. Choose a lower KVP to reduce radiation exposure and improve image contrast. C. Use the highest possible to reduce exposure time and ensure the clearest images. D. Employ automatic exposure control to adjust the radiation dose based on the patient's body size. Answer. Correct answer. D. Employ automatic exposure control to adjust the radiation dose based on the patient's body size. Explanation. Automatic exposure control systems adjust radiation dose based on the patient's body size and the area being imaged, ensuring that the radiation dose is minimized while maintaining image quality. This helps to reduce unnecessary exposure. Other methods such as adjusting KVP can be used, but EEC is the most effective and efficient option in modern CT imaging. Question 27. Ethnologist Lisa is asked to perform a routine abdominal X-ray on an elderly patient. The patient has a history of kidney disease and has been receiving multiple imaging studies. Lisa is concerned about the cumulative radiation dose the patient has received over time. What is the most important consideration for Lisa to minimize further radiation exposure for this patient? A. Perform the X-ray using the highest and the lowest exposure time to ensure image quality. B. Use advanced imaging techniques that will reduce the need for repeat exposures. C. Review the patient's medical history to determine whether the X-ray is necessary at this time. D. Avoid using shielding as the patient is elderly and may not tolerate it. Answer. Correct answer. C. Review the patient's medical history to determine whether the X-ray is necessary at this time. Explanation. When dealing with elderly patients or those with medical conditions like kidney disease, it is crucial to review their medical history and ensure that the X-ray is necessary. The ALARA principle advises that imaging should only be performed when clinically justified, especially when a patient has already received multiple imaging studies to avoid unnecessary cumulative radiation exposure. Question 20. Radiologic technologist David is performing a fluoroscopic procedure to guide a spinal injection. The patient has a large body habitus and David needs to optimize the imaging technique. Which of the following is the most appropriate action to ensure image quality while minimizing radiation exposure in this situation? A. Use a higher to compensate for the increased body thickness. B. Increase the KVP to improve image contrast and minimize radiation exposure. C. Use a lower KVP to reduce radiation exposure but adjust exposure time to maintain image quality. D. Increase the fluoroscopy time to reduce the number of exposures required. Answer. Correct answer. B. Increase the KVP to improve image contrast and minimize radiation exposure. Explanation. For patients with a large body habitus, increasing the KVP helps penetrate thicker tissue and improves image contrast, thus reducing the need for excessive radiation exposure. This approach also helps ensure adequate imaging without increasing exposure time. Higher or longer fluoroscopy times could increase radiation exposure unnecessarily. Question 29. Acknowledgist Sarah is performing an X-ray for a patient who is 20 weeks pregnant. The physician requests an imaging study of the abdomen. Sarah is concerned about potential radiation risks to the fetus. What is the most appropriate action for Sarah to take? A. Perform the X-ray with standard settings and apply protective shielding over the abdomen. B. Perform the X-ray but use the lowest possible settings and limit exposure to the area of interest. C. Avoid performing the X-ray altogether as any radiation exposure to a pregnant patient is dangerous. D. Inform the patient that the radiation exposure is negligible and proceed with the procedure. Answer. Correct answer. B. Perform the X-ray but use the lowest possible settings and limit exposure to the area of interest. Explanation. When imaging pregnant patients, it is essential to use the lowest possible radiation dose and focus the exposure on the area of interest. Protective shielding should be used whenever possible. It is also important to explain the procedure to the patient and ensure that they understand the necessity of the imaging study. Avoid procedure altogether is not always appropriate if the imaging is clinically necessary. Question 30. During a diagnostic X-ray procedure, technologist Rachel is asked to perform a lateral skull X-ray on a patient with a previous history of head trauma. The patient expresses concern about the radiation exposure. How should Rachel address the patient's concerns while ensuring that the X-ray is performed safely? A. Reassure the patient that the radiation dose from the procedure is minimal and proceed without further discussion. B. Explain that the procedure is necessary for their diagnosis and use the ALARA principle to ensure that the lowest dose is used. C. Encourage the patient to decline the X-ray and request other imaging modalities, such as MRI. D. Perform the X-ray without mentioning radiation exposure to avoid causing anxiety. Answer. Correct answer. B. Explain that the procedure is necessary for their diagnosis and use the ALARA principle to ensure that the lowest dose is used. Explanation. It is important to explain the rationale for the procedure and reassure the patient about the safety measures taken to minimize radiation exposure. Using the ALARA principle ensures that the exposure is as low as reasonably achievable while still obtaining the necessary diagnostic information. Open communication helps alleviate patient anxiety and enhances trust in the healthcare process.